Today we have Dr. Dravid, who is a specialist in infectious disease, where he's going to talk about a lot of interesting facts that you may not be aware of. Or, of course, there are certain things that we are just aware of, but we don't really know much about it. Thank you for joining us for this podcast, Life Lessons and More, Dr. Dravid.
Thank you so much. Thank you so much, Ameet.
How did you choose infectious disease as one of your specialty when it comes to this profession?
Somebody's asking me this question after my wife popped me that question just before marriage. So,
Oh,
I'll tell you a very interesting story behind it. This was in 2003 when there were hardly any medicines. People were dying left, right, and center for want of good HIV care. And the whole field was pretty dismal. The results were pretty dismal. So I said, what are we going to do in this field? So I said, okay, it looks like a challenge. Let me accept it, say, for 3 months and see how it goes. So I started working with HIV infected patients and their families and their close contacts. And what I saw in 2003 really upset me. And it really set a dagger through my heart that so many people in need of treatment, in need of counseling, in need of some hope are left hopeless because there are no medicines, there are very few doctors treating them. The whole idea of the society towards HIV infected people is that of hostility. At that time, it was open hostility. There is a lot of discrimination, which is there even now, although it is less than that which was there 15, 17 years back. And there are really some promising drugs which are coming into the market. Maybe they'll come in 5 years down the line. But what do we do now with this population, which is very sick, which needs treatment urgently, which is getting sicker by the day, which is getting admitted in hospitals, and because of want of good care and lack of empathy from relatives and doctors, they are dying. So that day I realized that this is a challenge which I need to get into and I need to start working in. And my parents were really confused whether they should let me do this field. But it was my wife who said that if you like it, if you like what you're doing, and if you really have your heart set on going into infectious diseases, and with infectious disease, it meant HIV, because out of infectious diseases, it was the most challenging infectious disease in 2003. Go ahead, do it. And that's how I worked for 1 year in HIV medicine for the first time in 2003, where there were a lot of patients quite sick in need of treatment. And we did a fairly good job in that 1 year. And before I went for my post graduation, I already knew that I was going to come back and become an infectious disease doctor. So when I went for my post graduation and told my colleagues in Bombay that I was going to do infectious diseases and I'm going to do HIV medicine, they were all laughing at me. Like, are you crazy? Go ahead, do cardiology, go do gastroenterology, do endocrinology, do cancer or oncology. Those are the branches which are the hip and new and in branches as of now. Who does infectious diseases and who treats HIV patients anyway? But I'm glad that I listened to my heart and my wife stood by me, and today I am relatively successful, and I hope I am a good infectious disease HIV doctor.
You are doing a great job, and I must
Thank
tell
you.
all my viewers, he's fantastic. So thank you for that story, and thank you so much for choosing this profession.
Yeah.
Thank you.
It's just like people face discrimination, even doctors do face discrimination in their career choices. And HIV is one such career choice where many doctors have faced discrimination, but gladly they have stuck to what they like, and they're doing a good job all over India, all over the world. Whoever is in HIV right now is doing a phenomenal job.
Considering now we spoke about you choosing this field, specifically HIV studies and curing and preventing HIV, how is the journey so far for you in India?
Yeah, it's been a roller coaster ride, I must say. From 2003, when I went to Bombay for doing my postgraduate, I was a bit unsure whether I should come into a branch where so many people are dying. One day, I will tell you, when I was in Pune in Ruby Hall, I signed 10 death certificates of HIV positive patients in one day. That high was the mortality in 2003. And I just got frustrated by the end of the day that I am well meaning, but there are no tools to fight this disease. We know what the disease does. We know what is the natural history. We know that for 10 years the patient will be fine. After 10 years he will develop either tuberculosis or some other opportunistic infections, and then he'll get sicker by the day. And over the next 1 or 2 years, if we don't do anything, he will land up in full-blown AIDS. We knew that. But then how to tackle it? We did not know. But in the last 18 years, we have almost 28 new drugs from 7 different classes which have been discovered for this disease, and no other disease has seen such an explosion of new medicines coming into the market as HIV has. So 28 new drugs in 15 years means we are almost bringing 2 new drugs every year into the market for HIV care or for treatment of HIV positive people. And not even diabetes, not even hypertension, not even kidney disease, not even cancer has had such explosion of new drugs coming one after another in such a short time. And what has happened because of that is now HIV has been transformed from a sure shot killer in 2003 when I left and went to Bombay to a chronic manageable disease just like diabetes or blood pressure in 2021, where if you take the tablets regularly and I prescribe the tablets regularly to you and you take it regularly, I can assure you that your virus will be suppressed and you will survive for decades together. So we are not even talking of years, we are talking about decades. So in the US, people say that if you're 20-year-old and you're HIV positive, then we can guarantee that you have 5 decades of active life more on top of the 20 you have already lived. So you can survive up to 60s and 70s and you'll be fit and fine. So it has now become the most cost-effective, chronically manageable illness ever known to mankind. So even anti-HIV therapy has surpassed anti-diabetic therapy, anti-hypertensive therapy, anti-cancer therapy, or any other known dialysis for kidney disease. All these therapies have been left behind, and anti-HIV therapy has become the most cost-effective therapy because it is available pretty cheap, and the years it is adding to people's lives is phenomenal. So, from being the outcasts in the society, in the doctor society, we suddenly talk about our patients living longer today than diabetics, our patients living longer today than people who are hypertensive, our patients living longer than people who have heart disease. So I always jokingly tell my patient that I don't get worried about your HIV, but I do get worried when HIV people have diabetes, or when my HIV infected people develop hypertension, or my HIV infected patients develop kidney issues, because those diseases are far more taxing and far more difficult to manage than HIV today. HIV has become a cakewalk. One pill once a day for years together can guarantee you a life of how many? 30 years, 40 years. Who would have thought this 15 years back? It was impossible. So what we have achieved in a short span of time is amazing. And what I can say is better drugs are coming. So today I am talking of one pill once a day. If you interview me 1 year later, I'll be talking about injections which are to be taken once a month. So 12 jabs or 12 shots in a year, and you don't need to take any pill. Everything has just changed. The scenario has gone into how to improve the quality of life of patients now, not about quantity. The quantity is going to improve anyway. You have to be dumb enough to stop the pills to fall sick now. So now the treatment has been taken off from my hands and it's in the hands of my patients. So I always tell my patients that even if you don't meet a doctor, if you take the pill, you won't need to go to a hospital for care. It's that simple. So remember that the doctor is not important. The pill is important and you are important. If you are motivated, no person on planet Earth can stop you from leading a healthy life. It's become that easy.
It just kind of brings that fresh air in.
Yes.
A lot of people do not really know and are not aware of the kind of transformation that has happened, and we've just
Absolutely.
spoke about that. So
Absolutely.
yes, that was really needed. Thank you for that. India specifically, when we talk about different sections of societies, which specific section of society do you think is more affected or impacted when it comes to HIV, according to you?
The National AIDS Control Organization, which works in HIV in India, and puts out its report every 1 or 2 years, is now very clear that there are certain populations now in India which are high risk populations where the risk of HIV is pretty high even now. And then there are certain called as bridge populations which act as a bridge between the high risk population and the general population. So the high risk population, some of them you already might know, which is the female sex workers. So around 2.4% of female sex workers in India are HIV positive today. In various parts, the positivity rate can vary. In industrialized states like Maharashtra and Tamil Nadu, the positivity rate amongst female sex workers is anywhere between 6 to 7%, while in other states it might be lower. Then the second is men who have sex with men. I'm happy that Article 377 was scrapped and Supreme Court brought out a very, very good verdict where you are now free to practice your sexual preferences as per your needs in India, and that was a great judgment. But still, the MSM population, as we call it, is a high risk population for HIV in India. There have been multiple surveys, and in Maharashtra, around 5% of MSM population is HIV infected. So out of 100, 5, if I may say so, gay men are HIV positive, and so it's a high risk group. And why is it a high risk group? Because anal sex per se has a high chance of HIV transmission as compared to vaginal sex. It's almost 18 times more likely to transmit HIV as compared to vaginal sex. So because you are having a high risk sexual exposure, plus if you don't use condoms, then it makes the condomless anal sex a very, very potent tool for transmission, not just of HIV, but of any sexually transmitted disease. So you look at Hep B, hepatitis C, syphilis, gonorrhea, chlamydia, along with HIV, all these sexually transmitted illnesses will spread faster if you have condomless anal sex. So, and luckily now we are talking more and more about this issue because we care about the MSM population. We know that the disease is rising in that population. And now with the legality taken care of, we expect that the population comes forward, tells us their issues so that we can tackle the scourge of rising HIV in that population as well. Because if they talk, then we can help them. It's like that. It has to be a dialogue. I can't just thrust my views on them, nor can they thrust their views on me. It's better that if we talk, then and through this forum, I would like to encourage my MSM friends that they should come forward, tell us if they have ever engaged in condomless anal sex in the past, say 1 year, so that we can tell them about the risks. We can tell them about what they can do to protect themselves, not just from HIV, but also from other sexually transmitted diseases. Then the third population is the injection drug abusers. As you know, Northeast India, there is a big injection drug abuse epidemic where they inject drugs like heroin or cocaine for recreational purposes. So states like Manipur, Nagaland, Mizoram, there is a big injection drug abuse epidemic which fuels the HIV epidemic as well. And then, as I said, the bridge populations are two. One is the single male migrants. As you know, there are a lot of people from poorer states like UP and Bihar who settled in Maharashtra and they are away from their families for years together. And these are the people who happen to visit female sex workers. And these are the people then who get infected from them, and they act as the bridge to and if they go back to their hometowns and they infect their families, then they act as the bridge to transmit the infection from the high risk group to the general population. Similarly, truck drivers who also carry medicines or vegetables or other stock they take from one state to another, they go on highways, again they are away from their families for months together, and they also can indulge in condomless sex or with a female sex worker, and then they can carry it to their families. So the high risk population and the bridge population. Also, I forgot to add that there is one more high risk population, which is the transgender men or women, or we call as hijras in our local language. Luckily now, even the Supreme Court has accepted that being transgender is not a crime. It is just a third gender, and has mentioned being transgender as a third gender in multiple government forms which have recently come out. So even that has been accepted. But again, transgender men especially do participate in condomless anal sex, and because of which they are also at high risk. So all these high risk populations need to have a good dialogue with healthcare activists, healthcare workers, so that their
Right.
problems can be understood and they can be tackled.
And how does someone know that, okay, now it's time for me to go ahead and get tested
Okay.
or approach a
Yeah.
doctor?
Yeah.
Are there any symptoms that they can look for?
So, unfortunately, HIV is known as the silent killer. That means
Hmm.
when it enters your body,
Hmm.
for almost 8 to 10 years, it will do nothing. So
Okay.
many people who come to my clinic in say advanced stage of HIV always tell me ki doctor, for last you are telling me that I might be having the infection for last 8 or 10 years, but
Hmm.
for the
Hmm.
because I have had sexual relationship with a female sex worker 10 years back. For the last 10 years I have been married, I have never had sexual intercourse with anybody other than my wife. So
Hmm.
now if you're telling me for I got infected 10 years back, why didn't I fall sick? The problem is the incubation period of this disease is in years, not in days. So if the
Hmm.
virus enters your body, it goes and starts attacking your immunity, which we call the CD4 cells, and gradually starts reducing the CD4 cells in your body. The problem is our body, human body is so robust that it has enough supply of CD4 cells to withstand the viral infection for almost 8 to 10 years. Only once the reserve finishes, that means the body is left with no reserve to tackle the virus. That means when the CD4 count goes below 200, that is when your body is really sick, it really needs help, and that is when you will start getting all infections. So you will get your tuberculosis, you will get your herpes zoster, you will get your diarrhea, you will get your weight loss, you will get your long standing fever, you will get your cancer. So all these things will start happening, but that will be pretty late. So I always tell my patients that don't wait for the symptoms to begin.
Hmm.
If you have had sexual relations out of wedlock without condoms, or if you are an MSM person, if you have had condomless anal sex, or if you are a bridge population, if you have visited a female sex worker, please come forward, test yourself, because the test will cost you anything between 200 to 500 rupees. I'll
Hmm.
put you on treatment, but once I put you on treatment, I can guarantee you that you will never need to visit a hospital anymore. We can tackle better. So it's always about when the symptoms come, it is pretty late. Remember that. So once you develop fever, weight loss, diarrhea, lymph node enlargement, tuberculosis, herpes, it is pretty late. You really have to act. It's an emergency. But if you come early, you identify that I have had some issues in the past. If I was an injection drug abuser, or I have had unprotected sex, come forward. There is nothing wrong in coming forward and telling the doctor that please get an HIV test done. Doctors are large-hearted enough to accept whatever you have done. You want to atone for it and you want to do an HIV test. It's fine. Get it done and start the
Hmm.
treatment.
Hmm.
Similarly, now more and more hospitals are testing every patient admitted in their hospital for HIV. Why?
Oh.
Because yes, because the US CDC clearly showed that even if you are admitted for diabetes in the hospital, get an HIV test done. Even if you are admitted for heart disease in the hospital, get an HIV test done. If you are admitted for kidney ailment, get an HIV test done. If you do it, that is called as universal HIV testing. That means
Hmm.
testing everyone who comes to a hospital, whether it is in an OPD or in an IPD for HIV. They found that 40% of HIV positive patients who later turn out very sick in the hospital
Hmm.
have visited the hospital in the past 2 years for symptoms which are unrelated to HIV. So maybe they had just sardi, khasi, bukhar, zukam, and they visited a hospital. And
Hmm.
because they did a test, but they did not do an HIV test, thinking कि सर्दी खांसी में क्या HIV होगा. So it's
Hmm.
always we try to put HIV in the context of only tuberculosis, herpes, weight loss, poor
Hmm.
people, female sex worker. So we try to be judgmental. Remember that
Yes.
HIV can infect anyone. You can infect a rich man, it can infect a poor man, it can infect a truck driver, it can infect an industrialist. It does not discriminate on the basis of socioeconomic status, religion, gender, how rich you are, how good looking you are. It does not discriminate that way. You can get HIV anytime in your life. Please don't forget that. And that's why I said that universal HIV testing in hospitals led to 40% more diagnosis than before. So that's why now, even at Ruby Hall Clinic where I visit, in Pune Hospital where I visit, in Noble Hospital where I visit, every patient who is admitted for any condition in the hospital gets an HIV test done. We tell them that with your routine tests which we are going to do, we are going to do an HIV test as well. If they say no, they can opt out from that testing. But
Right.
to my surprise, very few, almost only 1% of people have said no to an HIV test. When we tell them that it's just a routine test and we do it as a package for all the tests, so just like we are doing sugar routinely for you or a hemoglobin routinely like you, we are going to do an HIV test routinely for you. And we have now found so many patients getting identified much earlier than they would fall sick and then come to us. And that's why we can change the prognosis of these guys. We can change the entire life cycle of these guys by treating them early. So the whole idea is test everyone, treat early, and give them a healthy life.
There are situations, there are weekends, there are parties, there's
Yeah,
clubbing, and now the whole life has kind of transformed for youngsters. And India has the
yes,
maximum young crowd
absolutely.
that we all know now. Are there any preventions or are there any ways to ensure that you avoid these circumstances?
India is a very young country, and
Yes.
our average age is just 27. That's why maybe we did not suffer so much from the COVID epidemic than what the West and Europe suffered, because they are a much elderly population. And with a lot younger population, there are advantages and there are disadvantages. The disadvantages are they are more experimenting, they are more outgoing, and they might indulge in condomless sex with multiple partners at a party. And that party might also involve recreational drug abuse, which is quite likely along with condomless sex. So now the HIV science has given us two different ways of preventing the infection, not treating the infection once it happens. It is about prevention of disease. So what we want to say is that if you are the MSM community and you have engaged in condomless anal sex in the last 6 months, and maybe you will also engage it in the future, you can't guarantee that there will be parties and there will be sexual encounters with people whose HIV status you don't know. You can't go to a party and ask the partner what is your HIV status. It will put him off, and that will be the end of that relationship. So
Right.
things can happen. Sexual encounters without condoms can happen, and in fact there were studies which showed that in such parties only 40% of the sexual encounters were with condoms. So almost 60% of the encounters were without condoms. So in that case, when you are going to have condomless anal sex, then there is something called as pre-exposure prophylaxis or PrEP, which is now gaining ground in the West, and it has been legally been given through all NHS hospitals in the United Kingdom as an essential preventive measure, especially for the MSM community and also for other communities which have high risk of sexual transmission, like female sex workers. So tomorrow, if you are an MSM person, you are going to engage in condomless anal sex, I would recommend that you take PrEP. What is PrEP? PrEP is pre-exposure prophylaxis. It just contains one pill. That one pill contains two drugs, tenofovir and emtricitabine. These are two HIV drugs which can prevent the virus from entering into your body despite you having sex with a person who is HIV positive, but maybe he has concealed his identity and has not told it to you that he is HIV positive. So what happens is, tomorrow you have condomless anal sex with a man who has hidden his HIV identity. He has had sex with you. The virus is there in your genital tract. That should not enter your bloodstream and you should not get HIV positive. That window is about 72 hours. So what we can do is either treat you after exposure, which is called as post-exposure prophylaxis, or give you some drugs which are there in your blood all the time, which is called as pre-exposure prophylaxis. That means when you go to a party, you already have drugs circulating in your blood, which will not let the virus enter your body, even if it gets deposited in your genital tract. So that is called as pre-exposure prophylaxis. You take one pill containing two drugs, tenofovir and emtricitabine. you take it regularly. So ideally, you are supposed to take it every day, because we can't guarantee when there will be a party, when there will be a sexual encounter, and when there might be no use of condoms. So you have to be responsible, come forward, adopt PrEP. The whole MSM community has to adopt PrEP as a way of life. If you are going to engage in condomless anal sex in the near future, start PrEP, take it regularly. If you take at least 4 times a week the pill, then the protection goes above 90%. So the protection is almost 100% if you take every day, but at least take more than 4 times a week. One pill, at least 4 days a week. 4 days of out of the 7 days in a week, and continue it till you're either going to go into a monogamous relationship with an HIV negative person, or you're going to go into a monogamous relationship with an HIV positive person who is taking antiretroviral therapy. So if your partner is HIV positive, he is on treatment, his viral load is suppressed, he has guaranteed you that he will use condoms every time you have sex, that time you don't need PrEP, because there his viral load is suppressed, he is going to use condoms. But if you are not going to be in a monogamous relationship, you will have visiting recreational parties where sex cannot be guaranteed. Then you should take PrEP. Ideally, it should be daily PrEP, but there is something called as on-demand PrEP as well, because some people can't take medicines every day. So on-demand PrEP is where you know that tomorrow is a party. Tomorrow there might be a sexual encounter which might happen. 24 hours before that, you take 2 pills, not one, on the day before the encounter. Then you go to the party. On the day of the encounter, you take 1 pill. Then 48 hours after the encounter, you take 48 hours, you take 1 pill on day 1 post encounter, 1 pill on day 2 post encounter. That way, you protect yourself during the crux of the period, which is the sexual encounter. That is called as on-demand PrEP. But we still recommend daily PrEP over on-demand PrEP. Daily PrEP is anytime better. You are at peace. You don't have to, time your sexual encounters. You don't have to time your parties. The pill is there. It's working. And as I said, it will reduce your chance of sexual transmission by more than 95% if you take the pills regularly. The problem again for PrEP is it is in your hands. If you are responsible, you take the tablet regularly, you will not get infected. But if you say, "Nahi, today I am not in the mood, I stopped the pill, today I have drunk, I have alcohol, so today I'll skip the pill," that is not done. Anything in life you have to have discipline. If you want to prevent HIV and other sexually transmitted diseases, then you have to take PrEP regularly, daily, and ensure that until you get into a monogamous relationship, you continue that PrEP. Then you will be HIV negative, and then you can keep testing for HIV every 3 to 6 months to find out the efficacy of the PrEP. But I'll pretty much sure that if you use this, definitely your chance of catching HIV goes down drastically. The second thing is about post-exposure prophylaxis. Suppose you don't listen to the doctor. You think, yeah, doctor is saying all bullshit nonsense. What is he talking about? Taking a pill daily. I am a fit man. I'll go to a party. Suppose you go to a party, have condomless sex. Then morning after you wake up and you realize, oh God, my partner did not wear a condom. He ejaculated inside me. Now what do? I can't find a partner because the party is over. He's gone to some different place. I don't know his HIV status. Now what do? Do I suffer? Do I keep that mental torture? I keep on suffering that, oh no, I might have had exposure to HIV. No. Go and visit an HIV doctor. Tell him that you have had an exposure, a high risk exposure in the last 24 hours. Remember, reach the doctor within 72 hours, because the virus will be there in your genital tract for about 24 to 72 hours. That is 3 days before it will enter your bloodstream. Before that, my drugs have to reach, which is post-exposure prophylaxis. And that is also 1 pill, but it contains 3 drugs, because now I have to act in an emergency. So I have to give 3 drugs in 1 pill, which is called as post-exposure prophylaxis pill. That pill I will give you for 28 days. You have to take it regularly for 28 days, and then you have to test yourself after 28 days to look for HIV infection. Even this way, I can prevent the infection to you by almost 95%. So remember, post-exposure prophylaxis always helps, but pre-exposure prophylaxis for the MSM community is the best. Similarly, if you are a female sex worker or if you're a transgender man or woman, where you're already going to have a high risk exposure to HIV, then if you are HIV negative, and remember, post pre-exposure prophylaxis or post-exposure prophylaxis is only for HIV negative people, not for HIV positive people. So you need to do your HIV status first and then start PrEP or PEP. You can't just start it without doing an HIV status because it is meant for negative people. Antiretroviral therapy is meant for positive people. So all these high risk communities deserve to get PrEP and they should start it.
Yes, and I think this is something that I must rephrase, that it's always good when they say that prevention is better than cure. I think PrEP is something that is interesting and it's very useful, very safe. And you are, once you are taking it every day and you have decided to just make it a part of your timetable, I think it
Yes,
just becomes a regular activity and then
absolutely.
you're relaxed.
Absolutely.
Just to understand, doctor, are there any possible ways to live a healthy life, even if you are HIV positive?
You're going to become an old man of 60 or 70 if you are an HIV positive 20-year-old today.
Mhm.
So remember that your life is set. You're not going to die. You're not going to die of HIV anyway now. You just have to take the pill regularly. Now, in those pills also, initially, the problem what we used to face was the pills were very effective. They were
Mhm.
suppressing the virus, but they were causing side effects to almost 15 to 20% of our people. So
Mhm.
what people used to say that sir, the drug is fine, I'm gaining weight, I can now, work 12 hours a day. But every time I take the pill, I feel giddy. In the night, I can't sleep properly, or maybe I sleep too much. In the morning, when I wake up, I feel as if I have had alcohol at night, so that hangover feeling remains. In the
Mhm.
morning, for the first two hours, I can't concentrate what my wife is telling me, what my kids are telling me. I have to go somewhere. I just sometimes feel so groggy that I still stay at home. So
Mhm.
those side effects, which we used to call CNS or central nervous system side effects, were occurring because of drugs which we were using. The drug was efavirenz, which was the mainstay of the therapy, one of the mainstay of antiretroviral therapy in the past. But now a new drug has come, which is called as dolutegravir.
Mhm.
That has revolutionized treatment because first it is only a 50 milligram pill, so the dose is now much lesser. Efavirenz was a 600 milligram pill. It had to be combined with tenofovir and lamivudine, so three drugs into one pill. Now
Mhm.
we combine dolutegravir with tenofovir and lamivudine, so we call that combination as TLD, and that is
Mhm.
the most in combination right now. And I am sure that within the next 1 year, 90% of HIV positive people in India will be on TLD combination because dolutegravir is only 50 milligram, so the
Mhm.
dose has been reduced 12 times. Secondly, it has hardly any side effects. So the side effects have come down. So people say ki once I take this pill, the new pill, I don't feel groggy in the morning. I don't feel hungover. I don't
Mhm.
feel giddy. I don't
Mhm.
feel that I cannot concentrate on my job. And it became problematic, especially for people who are IT professionals
Mhm.
who had to sit in front of a computer and had to work at night because they had US calls, they had Australia calls, they had Europe calls. So they poor fellows used to work from 7 in the night to 2 o'clock in the morning. And if you take
Mhm.
the pill at 9 o'clock and they start feeling giddy, then it used to affect their work. Similarly,
Mhm.
those who are drivers or truckers, if you start taking the pill at night and they drive at night, it became a problem because driving in the night is a very risky job. It became more riskier by taking this pill.
Mhm.
Also, taking efavirenz used to cause depression in a lot of my patients. So people used to say that I feel that my life is worthless. I don't feel that it's going in the right direction. I feel that I am just a strain on my family, a strain on the society, and they used to feel depressed. So they're already getting depressed because of HIV. On top
Mhm.
of that, taking the pill was making them more depressed. Fortunately, this pill, the dolutegravir drug, has reduced that amount of depression as well. So
Mhm.
now the mood is better, the work ethic is better, the side effects are lesser, and
Mhm.
because of that, TLD and just one pill you have to take. So one pill once a day has made life much easier for HIV positive people. But as I said earlier, better
Mhm.
drugs are coming, injectable drugs are coming, where maybe you will have to take no pills, just one injection once in 2 months, six
Mhm.
jabs a year, and you are set, and your virus is suppressed, and you have no side effects. So you're getting into a scenario where you just have to tolerate 6 injections a year and then don't have to worry about HIV ever in your life. So that is where we are going at. But currently, as of now in India, TLD is the best combination, and it is available in America. The same combination is available. So our treatment is at par with the world. In fact, we are manufacturing, and we should be proud that India is the pharma of the world. We call India as the pharmacy of the world. And it started with HIV when India started exporting all these HIV pills to 175 different countries all over the world. So every 1 in 3rd HIV positive person in the world is taking an made in India HIV pill. So we should be proud that almost 30 to 40% of HIV infected people all over the world are taking made in India pills. So that is what we have achieved. Only one line like to add, Amit, in our entire discussion. There is no cure for HIV as of now. A sterilizing cure for HIV will be available only after 2030 is my guess, because that's what WHO has said, that we have to eliminate AIDS by 2030. Hopefully the gene therapy and all these things, we will be able to have an HIV cure after 2030. So I always tell my patients that at least for a decade and a half, you have to take drugs, you have to take it regularly, and you have to behave responsibly. Maybe once we have a cure, then we will move on to a better future or a better life. So as of now, no cure. As of now, only treatment.
Just before we end, Dr. Dravid, we definitely would like to know how, if someone wants to go ahead and approach you for some more information or maybe for a treatment, where do they find you and how can they approach you?
So, if you want to approach me for treatment or for any of your concerns, my clinic is at Bhandarkar Road, Pune, and the phone number of my clinic is 98601 44645. You can call, fix an appointment, and can meet me at my Bhandarkar Road clinic from Monday to Saturday. I am available at my clinic almost from 11 to 6. Sometimes because of the COVID duties which all doctors now have, the time schedule can get constrained. But if you call on the number, I'll repeat again, 98601 44645 is the appointment number. You can call and fix an appointment and come to meet me. Secondly, I also visit Ruby Hall Clinic, Pune Hospital, and Noble Hospital, Hadapsar, as a infectious disease HIV consultant. So if you are available there, you can come and meet me there as well. You can contact the local hospital desk and they will give you my number and get in contact with me.
So right below this video, you can find all the details of Dr. Dravid, and of course, you can contact him, approach him for anything that you would like to know more about infectious disease. And I hope to see a lot of questions coming in after this release. Thank you so much for your time, sir.
Thank you.
Thanks a lot.
Thank you.